kind of a paradox, yeah? If we talk about Silicon Valley, yeah, startups, funding, network, consultants, great ecosystem, everything right on place.
So it's pretty exciting to see. The only challenge remains in India because most of the startups, they don't see a commercial stage.
It's different, but the chances of getting success of a startup is colossal. Whereas, if I talk with respect to India, often there is a lack of funding or lack of guidance or lack of awareness or infrastructure.
While we were also trying to build that incubation center or accelerator for healthcare focused startups or medtech industry.
This is that everyone who starts and builds an empire often comes from a humble background.
The bond and the repo which gets built during the treatment, it brings back a lot of positive reviews.
Yeah, which might face or which may face criticism in the starting because that's the initial years of any entrepreneur journey.
While he was building, we were getting inspired by the discipline and the perseverance for a common cause of educating, the right education, right price, and for the right goal and target.
It solved some problem which was more manual in nature before, and now it is more maneuvered and mitigated and more streamlined and more precise.
AI will definitely be relevant, important, but they would not replace the clinicians, at least for next 1 or 2 decades.
I just want to mention one thing. I don't say it often, but I don't feel like that I'm talking to you for the first time. You want that Aakash should be known as this.
Should be known as the fastest growing, doctor-focused, patient-centric, ethical organization.
Thank you. It's an honor and privilege for me that you took out the time for this small podcast. I came here this morning and I saw the complete Aakash facility, the infrastructure, the kind of sagacious environment you have built, which is more like an ecosystem of healthcare, which is completely focused on holistic care of patients, and the validation is in itself getting the international patients, which I saw all across. Sir, you being a seasoned orthopedic surgeon and the managing director or the brain behind the complete Aakash infrastructure and brand, I want to, first of all, starting from a lighter note, I want to hear your thoughts, how you balance between being into the management and at the same point of time your knack of being an orthopedic surgeon yourself. How you balance and see to it.
First of all, thank you for this interesting podcast, and there's an opportunity to reflect upon a lot of things which we have done in the past. Balancing is coming natural, and it's not a one-day job. I still think myself as a surgeon first, and a doctor, and later on, the added responsibility of being an administrator and trying to build business around an ethical clinical practice. That came as a need of the hour. Back in 2010 when I started my private practice, and until today, these 16, 17 odd years of private practice, the first 10 years was only dedicated to creating value for my orthopedic practice, and gradually I felt that the more transparent you are in patient handling, and the more upfront you discuss each and every problem, and more empathetic you are once you have taken up a responsibility of caring a patient, and then you take them to handhold them till the completion of the treatment. Even thereafter, the bond and the repo which gets built during the treatment, it brings back a lot of positive reviews. Yes. It brings back a lot of more patients, smiling faces. And while I was doing that, there was a fortunate event for me that I was bestowed upon a responsibility to run a hospital, which I was totally unaware before I took this job. There is no MBA, there is no management schooling, which actually works on the ground. Yes, these schools would help you learn the management jargon, which may help you to make some presentations and impress the crowd. But actually on the ground, what matters is how you hold upon your staff, how do you select your doctors, that's your core team, and how do you make sure that every patient walking in the facility gets the best treatment, and that too at an affordable price. Since it's a private healthcare, everything somebody has to pay for it. There are insured patients, there are government payer patients, there are cash patients. Everybody has a responsibility to, as an organization, we want the continuum of the care in the best possible way, irrespective of their background, their affordability. We try and fit in each and every patient in our system. And while I was doing that, I felt that the system will work well if I just continue to focus on my core, subject, that is taking care of the patients and making sure our staff is safe, they are happy, and they are working with, joyous, in the joyous environment rather than as a compulsion.
True.
Everything what was revolving around the core things, the moment we start fixing those things, the moment we start building the clinical programs, the moment we made sure the staff engagement is positive and it's for betterment and for their growth, and the moment every patient started feeling that they are being cared for, the rest of the numbers, whether you call it the P&L, the business figures, the numbers, the financial compensation, everything fell into place. So I always believe that you continue to stick to your core thing and money will always follow. The financial numbers will always be right for you. So this is how, starting from a clinical role to an administration, I continue to, hold back the core values the same. And that has helped me to become an able administrator as well. Of course, there are a lot of learnings which for me as well every single day, and I don't shy away from learning from even the smallest or the biggest person working in this organization. So happy to play the dual role even today.
Beautifully articulated. I'm really mesmerized by the fact that how well you are just balancing both of it and combining it together to, develop a great workforce for Aakash and set as an example for all of us. That's amazing. I was reading through this brochure about Aakash Healthcare, and I saw regarding your, esteemed and respected father. I want to see what happens is that everyone who starts and builds an empire often comes from a humble background, from humble beginnings, and it's always tough to start, to initialize, to penetrate the market, to set the baseline and ideology, which might face or which may face criticism in the starting, because that's the initial years of any entrepreneur journey. I want to just have some insights in some backstory which you want to tell me and for the audience as a learning that how one can, from your father's journey, can really develop an influential business model and then take it way forward, which could serve as a benefit for people, society, and policies.
So for us, even not just for me, for the entire clinical team, most of our doctors have been his student as well,
Wow.
two to 3 decades ago. And everybody's, I would say, at least my role model is my father, because I've seen him, working 18 hours a day. I've seen him, starting back in 1972 with a 45 rupees per month salary, and renting, on the rooftop of a house. And from that particular point, the only thing which he continued to do is to provide a quality education, and the consistency in that delivery was bang on for 3 decades. And as and when, he was never a businessman, he was only a teacher. And he continued his passion to teach more and more students the right thing. And every time he was doing it, gradually the results started pouring back. And, the kids were getting successful, they were getting their, entrance exam clearing with, high grades. And that's how the name started spreading organically. And that organic growth was so, fabulous. But yes, it took time. Every business takes few years to establish and spread the name. And that was not the era of social media or Instagram. Everything was more organic, and we could not afford to, bring up big billboards, expensive billboards to actually market. So they were sticking to the core subject. Every student who's coming to that institute, they should be, dealt with just like you deal with your kids, and you do best for them for their education and learnings. And that's how that business was built. And while he was building, we were getting inspired by the discipline and the perseverance for a common cause of educating, the right education, right price, and for the right goal and target. And that, I think, of course, the genetics has flown, but more than that, it's the discipline or the environment which was created, and we somehow continued with that, the learnings and guidance from him. And even today, we see him working at the age of 75, 77, and he's working with the same passion, though the age is catching up, but he, from his heart and mind, he still feels that wants to work as long as possible for the betterment of society. Now he's in a philanthropic role where he wants to give back to the society, to all those people, help those people in one way or the other. They might have helped him in the last 3 decades. So there are a lot of things to learn. Perseverance, hard work, and discipline is something which can, you can create mountains out of nothing. And once you have achieved a milestone, you don't keep everything, all the wealth, everything to yourself.
Yes, true.
You want to go back to society and try and help them.
True.
So we are in the first phase of growth. Maybe one day we'll be, in a able position to help the other members of the society,
True.
apart from giving them good health.
True, absolutely. All my prayers are with you. And by listening to you and talking about your father, I'm really inspired and want to meet him someday for sure. So, as you mentioned that he started with helping students, it's always about the empathy, the emotional touch and feel with the students, that if a student performs well, if he excels, if he reach the eloquence of brilliance, then it's always a satisfactory feeling which cannot be quantified into numbers and metrics. Now I seen through this Lintex, and we're also talking this before this recording. You mentioned regarding the idea of promoting new startups, new ideas, new methodologies which could create disruption in the market, and you are providing the place and platform and fund before them. So I really think that you're resonating with your father, that as you support the students in the starting by giving them the right education at the right price point, now you're continuing the legacy of your father and also doing the same with, for sure, there is a time change and there is a transition. Now it's all about startups and social media and digital platforms and AI, which you are promoting and taking it way forward. I want to hear something interesting. If we talk about, a kind of a paradox, if we talk about Silicon Valley, startups, funding, network, consultants, great ecosystem, everything right on place. So I wouldn't say there is a huge difference, but the chances of getting success of a startup is colossal. Whereas if I talk with respect to India, often there is a lack of funding or lack of guidance or lack of awareness or infrastructure. So how you see that our Indians or Indian ecosystem are having the grit and that eagerness that they can make it big and colossal, especially the Gen Z or the young generation which are coming in, establishing themselves.
So if you look at the statistics, AI adoption and the people who are actually working on AI space, due to the sheer amount of maximum young population and exposure to social media, there are maximum number of people who are adopting AI, not just in their common practice, but also in form of startups. And, a push from the central government, push from the Prime Minister's office is heavy on making everything in-house. So the entire population, there's a lot of excitement around social media, integration, platforms, startups. In fact, the Niti Aayog and Startup India, they are having a great vision to create unicorns out of the modest background startups coming from various states. And while we were also trying to build that incubation center or accelerator for healthcare focused startups or medtech industry, we realized that there are fantastic ideas. I happened to be there to listen to few of the pitches, and we were amazed to see the energy level of young minds, even the middle-aged people who have got some kind of core knowledge about a particular subject, and they identify a problem and they go create a concept and start building onto that. So it's pretty exciting to see. The only challenge remains in India, because most of the startups, they don't see a commercial stage because of many reasons. one of the key reasons. Of course, funding, I would say now there is abundance of fund available from various sources, whether it's government or private equity or angel investors. But looking at how do we, from the idea stage, how we take it to a viable product, minimum viable product, and then we test in a real environment, and then we take it to a commercial stage. So these 3 or 4 stages requires a lot of hand holding. And you talk about healthcare is a very regulated market, and since we are dealing with patients, every healthcare startup which is going to either be used as a service for patient care, or if it is a product which has to go into the body as either as a drug or as a device or as a consumable or as a medicine. So it requires a lot of extra regulatory environments to be cleared. There is an ethics committee also. We cannot test anything which is not being tested, validated by a agency mix coming from various backgrounds, including the government representatives. So in healthcare, there are so many startups, but unfortunately, they don't get that validation environment. They don't get that ethics clearance. They don't get that kind of guidance. Funding, they would get it, but rest of the things are lacking, and that's why they're not able to scale up to a commercial level. So that was the idea why we wanted to give that, try in that incubator space. Let's try and hear out 50 to 100 startups which are working on that, and if we can be in a position to give them a validation environment, testing ground for a particular startup concept, it will be a win-win situation. We can provide that environment because we are in clinical space. They don't have an access to clinical space.
Yes.
They will get that access. They will get the hand-holding from the doctors and clinicians.
Yes.
And also in terms of raising funds, we can help them do that as well.
Yes.
But main problem or roadblock is testing their concept and making sure that it is going to work in the patients. So that environment is somewhere lacking. Not many. In fact, we got to know once we inaugurating. So ours is the first incubator and accelerator working in the hospital setting.
Wow.
In northern India. So there are not many. So technology people who are making the startup, they are sitting somewhere in the office.
Yes.
Hospital is somewhere else.
Yes.
They have no idea what ideas are being...
Lack of syncing.
Yeah, so there's no syncing.
Yes.
So we have to bring about some Uber-like concept of bridging the gaps and trying to see if they can, discuss with clinicians and bring about something. And clinicians can handhold them, guide them what is right, what is wrong in terms of patient care, so that they can fine-tweak their idea and bring about something which is going to be sustainable and can see the light of the day in terms of commercial concept.
Amazing, for sure. It's always like, if I tell you a difference, when we talk about medicine, or MBBS, it's always about the doctors who have been given the exposure of a hospital, they learn and they apply it. Whereas, even if I talk about IIT, it's all about that you practice, you learn into academia, and then you go for a job elsewhere. So there is no interlinking, but you said it right that, it's always about your idea, knowledge, which should be, which you have learned into academia and applied into industry, kind of into an ecosystem. Absolutely. Now, from more admin and management, I want to dive towards your clinical aspect. We are living in 21st century, rise of AI, machine learning, large language models, everything is on the rise, on the verge, or rather I would say, which is more than past 100 years. You, being an orthopedic surgeon, the seasoned one who has performed multiple surgeries over the past decades, I want to ask, by the rise of AI, has it acted as a catalyst for you? Has it, streamline your processes? Has it solved some problem which was more manual in nature before, and now it is more maneuvered and mitigated and more streamlined and more, precise?
So, in healthcare space, a lot of excitement for technology adoption, especially in robotics, and AI also is creeping in multiple areas of healthcare delivery. Yes, initially the low-hanging fruits, especially in the IT systems, where it's a service, it's a software service, where the AI implementation and data analytics have helped the management have a better governance in the hospital setting, especially once the hospital is located at multiple locations. How do you make sure that the quality is getting delivered in the right format everywhere? So for that governance purpose, AI module integrated with the hospital information system is working very well. Apart from that, there are many startups which are actually been scaled to a level where they're able to integrate the ICU patients, the critical patients, and they are also able to alert the doctor much early on about a possibility of a complication which might happen. So there are setups, there are startups which are focused on diabetic care, there are startups which are focused on early detection of strokes, heart attacks, and so many other critical diseases where if we implement them in a clinical environment and we validate that concept, I think we are looking at more of preventive healthcare rather than just doing the firefighting once the damage has already been done.
Yeah.
So I believe that AI is going to stay, it's going to grow, it's going to have a more important role to play in healthcare industry. Yes, AI is proven beyond doubt in many other verticals. Healthcare is the new kid on the block for them, and I'm sure in next few years, even the clinicians, ethics board, and everybody will realize the real potential.
Yes.
But one has to be a little more careful apart from the other industries, because ultimately we are dealing with humans, their lives, and anything which gets predicted wrong and which leads to a wrong treatment, may be catastrophic for the growth or the adoption of AI startups focused on healthcare. But yes, so far, if you are going very carefully, we are selecting those startups and the technology which only provide good benefit to the patient outcome. I think that's the way to go forward. And as and when you gain confidence, continue to open the doors and try and have more and more AI adoption even in the most critical areas of healthcare.
Amazing. Just to add to your answer and ask a question on that, there's a cliche question in the market, which is with respect to engineering or software technology or jobs which is related to more computer science, that AI would replace engineers, software developers, like all of that. Just to ask on a lighter note, do you think would doctors or surgeons would be replaced by AI in the upcoming future?
So, see, the way things are going, if you take us back to 20 years ago, nobody knew that a surgeon sitting in USA can operate a patient in Shanghai. So that was never a reality even in our mind.
True.
So today it's happening. So we never know that how the technology is going to become so relevant. But yes, the concept of empathy, the concept of surgeons or the clinician judgment, of course the AI algorithm is going to start learning that judgment thing, but every patient, every human body is very different. So I'm sure that AI will definitely be relevant, important, but they would not replace the clinicians, at least for next 1 or 2 decades. And of course, if the intelligence becomes so supreme in the artificial space, of course, there would be few activities which are very, process driven. For example, the airport check-in, checkouts, the security parameters, CCTV analysis. Those are the things where, we don't require a manual intervention. Of course, it is good for us also, because as the time is passing, the human intervention is there. The cost of hiring a specialist for a particular job, and then, as the attrition happens, we have to keep training them. Here we are looking at a system. Once we have trained on a module, the software is doing that job flawless 100% for next 20 years. So why to waste our human intelligence on a particular thing which can be easily done? So there, of course, replacement by a AI tool is definitely possible, or robot is definitely possible. For specific things dealing with human body, I think even at the regulatory space, even at the ethical space, even at the human-to-human connect phase, AI will always remain as an assistant or a support rather than the mainstream clinical delivery person.
Always a catalyst to support the process and streamline it. Perfect. All right, it was really really insightful so far. I want to just before we close it up, I want to ask regarding Aakash as a brand and you being the flag bearer to it. What's your vision and what's your aspiration, and what do you want to outcast for the upcoming future Aakash as a brand, as a principle, as a value which you want to provide, and you want that Aakash should be known as this. How you want to portray that?
Aakash should be known as the fastest growing, doctor focused, patient centric, ethical organization, and it should be the brand for masses. It should be a brand where everybody can walk in and seek quality healthcare at their price point. That's the aim of Aakash, and the footprint can be across the northern India. That's our first target, to cover the region in and around Delhi, 300 kilometers. And once we gain some confidence, we spread the wings to far and wide areas of Indian subcontinent. And we also strongly believe that Aakash can play a significant role in providing quality care to people coming from outside. There are more than 70 countries from where the patients are coming to India. And I would say I would rate Indian healthcare better than even the Western world in many sense.
Yes, true, absolutely.
Of course, the swanky hospitals, the big campuses, of course, we, due to the paucity of space in healthcare, we may not be able to boast of that. But the core thing, which is the doctors, Indian doctors are known, very well known across the globe because of our education system, because of our parents too much involved in the kids' education and their inclination for a noble profession like healthcare. So we are going to have the largest fleet or a population of quality healthcare professionals, and why can't we treat the entire world? Because we do it very swiftly, we do it with ethics, we do it high quality work, and we do it at 1/4 the price. Even then we build businesses around it. You see all the private equity players are flocking Indian healthcare market.
True.
Even when we are highly regulated, we are price sensitive, even then they see the potential of healthcare space in India because of the sheer size of population. Because everybody who is walking on this earth, eating, they would need healthcare.
True.
Whether it is COVID or non-COVID,
Absolutely.
healthcare is going to stay. It's a perennial, continuous, perpetual business or a vertical. So I strongly feel that India could be a hospital for the world. Or Indian context, we can say it's a Vishwa Chikitsalaya. And we should be able to be the number one destination for anyone in the world to seek a quality healthcare at an affordable price, and I think Aakash can play a great role in that.
Amazing. That's so beautifully articulated. I just want to mention one thing. I don't say it often, but I don't feel like that I'm talking to you for the first time. It's like that I know you from quite some time. It's more like a exchange of energies and ideas, enthusiasm, and by seeing your workaholicness, it's amazing, and I really look forward to a kind of in-depth podcast together where we can discuss more frameworks, more ideas, more public policies with respect to patients, hospitals, administration, international market, and all of that. So I know that you are you're short of time. It's just that I'm really happy and I'm really honored to have you here for the small podcast. It's more like a fun session, but I really want to have you. I really want to take your permission that I want to do a podcast with you in depth in the upcoming time. And
my pleasure.
Thank you, appreciate it, and I wish all the luck and success to Aakash, to you, your father, to make it big and global.
Thank you.
Thank you, appreciate it. Thank you, sir. Thank you, appreciate it.